Um, thank you. And with that, let's go ahead and get started. Next slide, please. Thank you. So just to give you a quick overview of today's agenda, so we're going to do just a quick welcoming. We're going to introduce you to our community grants program staff. We're going to talk to you about our funding opportunities that we had for this upcoming year, what application logistics will be needed and what we'll just need to be looking for, critical dates and technical assistance, and then we'll all have time for questions at the end. If you do have a question during the webinar, please feel free to use the chat and put in the chat and we will address the question at the end of the webinar. And when we get to questions, all you'll have to do is just press the raise your hand function and we'll work with you guys and we will get you guys unmuted so you can ask your questions. So with that, next slide, please. So here at the Urban Indian Health Institute, we always like to begin our meetings in a good way. And it's a very, and for those of us on the call and that working with our American and Alaska Native communities, is that it's an Indigenous value to prep the space and prepare before a meeting and being prepared and just coming into a grounding space before we do anything. And it's always just wanting to start things in a good way. And the way that we can start things in a good way, it could be whether someone shares a story, sings a song, a prayer, um, sharing experiences. It could really be, or even sometimes it could just be introductions or even an icebreaker. But again, that's up to everyone's own creative wanting and what they would like to do and just how they would, what you guys decide you want to do. But always just starting in a good way, just a great way for us just to center ourselves and prepare ourselves for things that we are about to talk about. So the way that I would like to start today in a good way is really just kind of thinking about why we do the work that we do. What is our why? And the great thing is that the Urban Indian Health Institute just went on a big staff retreat just this last week. And it was a very invigorating experience, to say the least, because we were able to be in a space all together as a staff and we were able to, without masks, being able to, interact with each other and just being able to have that some form of just contact, human contact with each other. And for those of you that don't know, the Urban Indian Health Institute has grown very extensively within the last year. So we have a lot of staff. And so we wanted to make sure that we were doing our due diligence and making sure that we bring people on in a good way. But it really got me to thinking, about what my why is. What is my why and for the reason I do the work that I do? I do the work at the end of the day for the love of Native people. But at the end of the day, my why stems from, my grandmother. My grandmother was a type 2 diabetic, and she was like my best friend as a child. And still to this day, I do not go a day without thinking about her. And that's where a lot of my why started. Then it came to, my own life, and seeing my Makah people from nearby Washington. The Makah, just like anywhere else, we suffer from disparities when it comes to chronic disease. And then to go even further, then I have siblings, I have parents, I have myself. And to go even further, now I have a niece and nephew, and I'm about to have a set of twin nieces and nephews coming in soon. And then I have, my staff, and then I have also our director, as well as our executive vice president, Abigail Equihawk, who has really helped shape my life and the way that I view public health and the way that I pursue public health. She does so much work for us and so much for our community that the least that I can do is I could help pitch in my work for her. Being able to take my unique skills and skill set and my own values and being able to take that and put that into the work and also help assist our director and just help our amazing women leaders, especially here at the Urban Indian Health Institute, finding ways to just continue finding, like, building on my why is why do I do the work? And that's really what, really, how would I say this? Really just invigorates me to want to do the work and gets me excited to do the work. And and it makes me so happy and passionate to do that work. And I think it's always going to be always on our staff, especially here at the Urban Indian Health Institute. We even tell this to all of our partners, always go back to your why. Why you do the work that you do? What's your I don't want to say, I mean, you could say purpose, but really I like to frame it as a why. Why do we do the work that we do? And just while, as you all go through your work and as you guys work on your applications, think of your why. Think of your why you want to do this work, but also what makes you so excited to do the work and what makes you so passionate to do the work. But with that, I don't want to take it on too long because I can go on forever because I'm quite the talker. But with that, could we go to the next slide, please? So now I would like to introduce our amazing team, and I'll have them introduce themselves. So first and foremost, my name is Thomas Lawrence. I'm an enrolled member of the Makah tribe out of Neah Bay, Washington. I am a program manager 2 here at the Urban Indian Health Institute. I am helping co-lead this team as we work to offer up opportunities to our community. Michaela?
Thank you, Tom. My name is Michaela Sakurai. I am Navajo and Palawan, originally from Phoenix, Arizona, and I am a program manager 1 here at the Urban Indian Health Institute.
Jessica?
Hello, everyone. My name is Jessica McGee. I'm a member of the Blackfeet tribe, originally from Browning, Montana, and I'm a project associate 2 at UIHI.
Thank you, Jessica. Chantel?
Oh, hi everyone. My name is Chantel. I am from Wide Ruins, Arizona, and I'm so excited for you all to be here today.
Thank you. So this is our management team. This is who you'll be mainly hearing in terms of application logistics and program management logistics in terms of management and being able to help move your project forward. Next slide, please. And this is our fabulous evaluation team. I do not think Dr. Rose James is on the call, but we have Dr. Rose James, who is our Director of Evaluation and Research. She is Lummi and Duwamish, and she has helped create and cultivate an amazing evaluation team here at the Urban Indian Health Institute. And I will pass it off to Daisha to introduce herself, if she's on the call.
Hello, everyone. My name is Daisha Gunther. I'm an evaluator 2 here with UIHI, and I focus on the SAGE grants that you will hear more about. Great.
Is Martell in the room?
Yeah, we're going to pass the laptop around.
Hi everyone. My name is Martel Hesketh. I'm a member of the Michelle First Nation, and I'm also an evaluator 2 here at UIHI. And I help with all of our Sweetgrass grantees and getting to collect all of your wonderful stories and sharing that back with our funders. So we're so excited to have you all here.
Hannah, if she's in the room.
I don't think Hannah she's not here.
Oh,
right
that's
now.
okay.
Maybe in a
So we
minute.
also have Hannah. We have Hannah as another one of our evaluators who helps oversee and helps work on our evaluation team. So funny thing about our evaluation team, all of our evaluators do not work on just one specific project. And so they're working on just a multitude of things. So we just have everybody here. But I'll pass it off to Jen.
Hi, everyone. Good afternoon. My name is Jennifer Herbert. I'm Navajo, originally from Flagstaff, Arizona. I am one of the evaluator 1s here at UIHI and will be providing assistance with Martel and Daisha on the SAGE and Sweetgrass grants. Thank you.
Thank you all. So yes, this is the team that you will be hearing from the most. When it comes to the evaluation requirements of the Community Grants Program, you will hear from Daisha, Martel, or Daisha or Martel mostly. And then for any program logistics or program management, you'll hear from Michaela or myself, or from Chantel or Jessica. We have a big, massive team. Our team has grown exponentially, and we've been able to just really increase our capacity. And so you're going to be hearing from all of us. We want to make sure that we're able to develop relationships with you all and being able to help serve you all in the best way that we can. Next slide, and I will pass it off to Michaela.
Thanks. Hello, everybody. Very excited to be here with you all. I'm going to be giving you a overview of the Community Grants Program. So the purpose of this program is to address chronic disease within urban American Indian and Alaska Native populations. So our goal is to showcase through data the brilliance and creativity of the organizations that we work with. So, and in this way, live up to our mission of decolonizing data for Indigenous people by Indigenous people. So our objective with the Community Grants Program is to encourage the use of American Indian and Alaska Native traditional, cultural, regional knowledge in the development, implementation, and support of chronic disease prevention efforts. So we understand that you and your communities have the solutions and answers to address chronic disease within your own communities. And so we want to honor the knowledge that you bring to the table, and just acknowledging how important it is to highlight the strengths that you all bring and the growing collection of data and stories that shows what we can do. So the Urban Indian Health Institute wants to continue to collaborate with our urban American Indian and Alaska Native serving organizations to reclaim the values of data, evaluation, and research. And this is all with the aim to strengthen public health capacity, to address health disparities, and to promote health resilience in urban Indian communities. And with that brief overview, I'm going to go ahead and pass to Tom, who's going to share some more about our two funding opportunities.
Thank you, Michaela. So the two funding opportunities that we have this year are our SAGE grants and our Sweetgrass grants. Next slide, please. In the next couple slides, we're going to go over what our focus will be, and then we're also going to go over the specifics of each grant. For this funding cycle for 2021 to 2022, our annual focus is overall chronic disease. So anything chronic disease related, we are willing to fund it. Any kind of chronic disease prevention work, we want to fund it. So, and I do humbly ask all of you, make our jobs hard, please. If there's anything that makes me enjoy my work more, is getting to read about everybody's proposals and the work that that everyone's doing, and then just trying to see, you know, who could best benefit from the funding. So please make our jobs hard. Next slide, please. So specifically for the SAGE grants, they will be, the granting period will be from September 30th, 2021 to September 29th, 2022. In this grant cycle, funds will be focused on Indigenous approaches to, but are not limited to, obesity prevention, commercial tobacco use prevention and cessation, type 2 diabetes prevention, and heart disease and stroke prevention. Applicants may apply and receive up to $95,885 over the span of 1 year. And UIHI will be releasing at least 6 grants, 6 awards this year, and and we'll continue to tell you guys this, but applications can be sent for SAGE grants specifically. Applications can be sent to Chantel Thomas. Her email is linked here in the presentation, and she also is linked within the application guidance. So yes, all information that is stated within this presentation is also in the application guidance packet as well. Next slide, please.
So for the Sweetgrass grant period, it's going to be the exact same as SAGE. It's September 30th, 2021 to September 29th, 2022. The same focus, it's going to be Indigenous approaches to, but not limited to, obesity prevention, cancer prevention, type 2 diabetes prevention, and chronic respiratory disease prevention. The Sweetgrass awards are $10,000, and we provide up to 4 grants that will be awarded. So for the Sweetgrass grant applications, they can all be sent electronically to Jessica. Her email address is listed here, and it also will be listed on our website. So to talk a little bit more about who is eligible to apply, we want to
clarify that all organizations must be one of the following to apply: an urban Indian organization, a Title V program as defined by IHS, a member of the National Urban Indian Family Coalition, an urban organization and or program receiving SASP/DVP, or formerly known as SPI/DVPI funding as defined by IHS, and on a case-by-case basis, a not-for-profit urban Indian organization whose leadership and board are made up of a majority of urban Indians and whose mission is to provide public health services to urban Indians. So there are some funding restrictions. They will be the same for both Sage and Sweetgrass. So recipients may not use the funds for research, for clinical care, nor to purchase furniture, equipment, or clinic/patient supplies. Recipients may use the funds only for reasonable project purposes, including personnel, travel, supplies, services. Salaries can be used as long as they are restricted to project activities.
Thank you, Michaela. Next, we just want to talk about the application components and what will be needed in order to submit your application to us. So for your submission, we will need a completed application form, as well as a work plan for the whole year, and a budget worksheet and justification. Now, in terms of budget, we do ask, so just so everyone's aware, our funding does come from the Center for Disease Control and Prevention, and they do ask for itemized information. So if you can, please try to be as detailed as you can in terms of like your supplies, in terms of any promotional items, mainly just try to give us as much detail as you can. Within reason, UIHI will work with you in being able to help identify any budgeting issues. But yes, we just want to make sure that we try to limit as much hang time as possible, which I'll be talking about a little bit later is what I mean by hang time. But again, so any Sage applications can be sent to Chantel electronically, and Sweetgrass applications can be sent to Jessica. Now, here's another thing. If all else fails, if electronically doesn't work for you and you need to mail us something, please let us know and reach out to us, and we will make sure to work with you in being able to do that. Funny thing, it's happened before, and so I wouldn't be surprised if it happens again. But if there's any questions in terms of submitting your application, feel free to reach out to us and we will be able to help you. Next slide, please. So the selection process, to kind of give you an idea of how UIHI is making these decisions. So for the two granting opportunities, the management team will be splitting up into two different committees. One committee for Sage and one for Sweetgrass. We will review applications as they come in. Excuse me. So UIHI uses a 3-phase equitable granting framework, which we use to try to increase transparency. But we also will be using a group consensus-based decision-making process where the committees will be also meeting with our leadership to help ensure that we are being equitable, we are being fair, as well as to ensure that we are making the best decision possible in order to serve our communities. Now, what I meant by hang time is once we receive applications and UIHI has made their decisions on who they will be awarding for the year, UIHI will have to send those selections to our funders at the CDC for written approval. So this process does take time. It can take time, but thankfully we have really good relationships with our project officers, so we can kind of help move things along as quick as we can. But it does take some time. So do be patient with us as we try to get those approvals. But once those approvals are given to us, UIHI will announce who our awardees are. And we are our goal, fingers crossed, if all goes well in terms of timeline, we want to announce our grantees by September 30th. Next slide, please. So big critical dates, big things that you really want to make sure that you know. So for the application deadline is Tuesday, August 31st, 2021 by 11:59 p.m. Pacific Standard Time. Any application technical assistance for the SAGE grants, you can reach out to me, Thomas Lawrence. My email is linked here in the presentation and also will be linked on our website. And for any technical assistance for the Sweetgrass grants, you can reach out to Michaela. And same as me, she is also on our website as well as in our RFA guidance. Next slide, please. So just to give you a quick rundown in terms of just timeline and just a reminder for everyone, just a quick summary. So we released the RFA on the 30th to everyone in June, so we could try to make sure it gets out to everybody as soon as possible. We are hosting our pre-application webinar today on the Monday, July 12th. Again, applications for SAGE and Sweetgrass grants are due to UIHI Tuesday, August 31st, 2021 by 11:59 Pacific Standard Time. And then we are planning to announce our recipients, our awardees, by Thursday, September 30th. And just as a reminder, the granting period is for September 30th, 2021 to September 29th, 2022. Next slide, please. And now this is your guys' opportunity. We wanted to offer space for you all to ask questions. So please, can grantees unmute themselves, or do they need to raise their hand? How do we want to do this? Michaela.
Yeah, if anybody has any questions, you can go ahead and raise your hand. We can click so that you're allowed to talk. So yeah, if you have any questions, please put it in the chat or raise your hand. Darlene, go ahead and ask your question, Darlene.
I think so.
Hi, I'm new to this, so I just had a question. I know that the goal is overall chronic disease. Does that change every year, the funding for the projects?
Oh, the funding projects? No. So in the past, we recognized when we were switching our focus areas each year, well, not necessarily specifically for our Sweetgrass grants, but for our SAGE grants, because we are giving out close to $100,000. That is very significant, and that can staff somebody that can do a very great project. So the reason why, so we used to do change the focus area each year, but that we figured out that that was not feasible. Thanks to one of our previous grantees, she notified us that it wasn't feasible for our urban Indian communities, because from having to switch from one topic to the other, it pretty much just like you have to drop a project and start another one. And being that that was not feasible, we wanted to open it up. So we opened up our chronic disease program, like focus area, so that it allowed programs to build on existing programs or building out new programs if they would like to.
Okay, that makes sense. I kind of looked through past grantees and I was wondering, so, okay, thank you.
Yes, absolutely. Thank you for your question.
And it looks like Chief Michelle has a question as well. So go ahead, Chief Michelle, go ahead and ask your question.
Hi, my question is about the budget detail. For example, if we wanted to focus on the type 2 diabetes and the disease, heart disease and stroke through including hypertension, self-monitoring blood pressure program, for that particular piece of it, would we need to, like, I guess, an estimate of how many blood pressure monitors we would purchase?
Yes, the CDC would want to know that information. They would want to know how many, how much do they cost, and then justifying why you would be buying them.
Okay, would I guess my follow-up to that is, it would be better to ask for more than we would anticipate needing?
I mean, that's always a good keen eye. I mean, I tend to do that myself in terms of budgeting. I try to like thinking, okay, here's my ballpark that I want to try to get, but maybe I can get a couple, maybe I'll get a couple more just in case.
Okay.
And that's the other thing. And that brings up a good point for me, is when you're thinking about your programs, definitely think about your targets. how many people do you want to try to reach? If that's how you want to, if that's how you would like to kind of think about your program, what's your target reach? And then kind of basing it off of that. But also at the same time, we are not worried about quantity. We are worried about quality. So even if we get like 3 people, that is still a big win for all of us. So
Right.
I definitely strongly encourage in thinking that way. Any more?
Okay,
Any
thank you.
questions? Cool. Thank you.
Thank you, Chief Michelle. It looks like we have another question from Sid. So Sid, go ahead and ask your question.
Sorry, I had to unmute there. Kwe Umatero, Hisise, Cynthia. I am wondering about the eligibility criteria for the not-for-profit urban Indian organizations. My group falls into that. In fact, we're a subset in terms of the nonprofit. We're a subset of a very large company, but our operation in Phoenix is entirely Native American staff and focus. And so how would I go about finding out if we would be eligible?
This would be a good question. If you could send us your information, we would definitely like to see just like maybe just like confirming that your leadership or board, like as the eligibility restrictions stay. Can you go back to them really quick, Michaela? I would say just showing proof of what we're asking for. So it says whose leadership and board are made of majority urban Indians. So if that's a possibility, being able to prove that within your application. And then also proving and then sending us information about your mission. And I believe that is in your application form as well, where we do ask what your organization's mission is. And if your mission is focused on the public health services of urban Indians, then I think if you just show us that proof, that'll be able to show us that you're eligible. But to also take it a step further, if you want to send us that information directly before you even apply, you can send that to us and we can confirm that with our leadership as well, if that helps.
I'd rather do that before I start putting together materials. So that
absolutely. So feel free to send that information to me. I believe my email is in there. Were you able to get my email, Chief Michelle? Or Sid,
I don't know.
Sid, excuse me.
Oh, I'm sorry. Yeah, I did get your email. I wrote it on here.
Yeah, I see it. I see it.
Okay, cool. Sorry about that. I completely got lost.
I've got it. Okay, I got it. Thank you.
Thank you. Any other questions, Sid? Did that help answer your question? Or,
yeah. Thank you. That's great.
I do have one.
Yes.
One more, Thomas, and this is going back to the detailed budget. And the diabetes part, everywhere we have put in for diabetes granting, we've noticed that nobody wants to fund actually purchasing glucometers because of the cost of the strips. Is that, have you seen that as well, or should we leave that out?
So from my experience, I do know that the CDC has definitely been quite sticklers, especially when it comes to, because then it kind of rolls into clinical services, which they do not fund. And so I have seen pushback from the CDC in terms of getting that information. However, those have been with other project officers. We haven't really had that issue. If you would like to propose it, I don't see anything wrong with that. I think it's just a matter of making sure that we stay within the guidelines as best as we can, or finding the best way to justify those strips being that it could potentially look like a medical service because these grants are able to provide clinical service.
And that's exactly what I needed to find out was if we were to start taking glucose test, if we started doing the testing ourselves, we're actually doing a clinical service. Which was why I was wondering if that's why nobody wants to fund that, because it turns into clinical, or or just because of the cost of the strips? Because
It could be.
it could be both, I think.
Mhm.
I think that's what you're going to say, is it could be both.
Yeah, I think it could
Because
be both. Yeah.
we've tried to avoid getting into that, because once you give out a meter, the assumption is that we're going to give you strips forever. And so I just wondered if we should even include that, but I think I see what to do.
Mhm.
Thank you, Thomas.
You're welcome. Any more questions? Darlene, I see your hand still raised. Sid, I see your hand still raised. Do you guys have questions still?
Sorry, no, I didn't.
No worries. Any other questions? We have Arlene has her hand raised.
Hi, Thomas. Can you hear me?
Yes, I can.
Okay. Yes, I had a question. Is there any type of format or anything as far as applying for this that you have us filling out, or you want us to just turn in our project?
You would just turn in your project. The application form, the budget justification, and the work plan, that all suffices as as your application. But if you do want to send in supporting documents, that is more than welcome as well.
Oh, perfect. Okay, thank you.
Yes. Any other questions or clarifying questions? Okay. So if at any time you guys have any questions in regards to the application, please feel free to reach out to Makayla or myself. We are more than happy to answer your questions. This is a big priority for us, as well as this is a very high level thing that we will be paying close attention to. If you email us, we will definitely get back to you within a day or so. But either way, we will definitely get in contact with you. But I believe that is all we have for today. Am I correct, Makayla?
Yep.
Awesome. Well, thank you guys so much for coming to UIHI's pre-application webinar for our community grants program for 2021-2022. We are looking forward to seeing your amazing projects. We're looking forward to see your amazing proposals. Again, like I said before, please make our jobs hard. We would love to hear what you guys are doing, and we would love to see the competition happen. But we definitely we're hoping for the best, and so excited. But again, thank you all so much. You guys have a great day. Bye.
Thanks. Bye.